Morning. Happy Saturday. Welcome to all of you here on YouTube and Instagram for our daily Natural Health News live show where we talk all things health and wellness as it relates to this situation surrounding the virus and our health and wellness. And today I am really excited to announce the CDC did follow through with my predictions earlier in the week. They did come out and recommend, it's not a requirement, but it's recommended as a new guideline for everyday individuals when you're out and about and you're not in your home or you're not in your car to be protecting yourself. So we're going to talk a lot about that this morning. I'm going to answer a ton of your questions and I'm going to talk about the response to yesterday's video. Actually, quickly put together a video last night, a different video that I was going to release, but actually whipped up a quick response to that, an announcement, and have had a lot of feedback from that. So we'll get into that and we'll really dig into our live show. So welcome everybody joining. For many of you new, welcome. I'm Dr. Melissa Gallagher. I'm a naturopathic physician. As a naturopath, my focus is addressing the root cause of illness and disease and really helping fortify my patients' bodies in optimizing their wellness. So this can range from lymphatic health to hormone health to digestive health and immunity. And especially in the world of lymphatics, there's a direct correlation to your lymphatic system and your immune system. So welcome everybody. Please let me know in the comment box below where you're tuning in from. We have a very large international community that joins us every day. So I always am encouraged by seeing who's on the live. And for many of you watching this on a replay, just know this format's a little different. This is a live show, so it's highly engaging, highly interactive. You'll see me reading comments and commenting and answering questions from our live viewers. And that is what the purpose of this live show is, to be engaging, encouraging, and interactive, because many of you are alone at home, and this is a digital resource for you to come together with a large community. And generally, we have anywhere from 200 to 300 participants at any given time. Usually, we have about 3,000 to 4,000 people watching this live show. So we are a large, broad community, and this is all about making sure you don't feel alone. We're in this together, and I just want to reach you through this amazing technology platform and forum. So, and I'm grappling with an outfit issue. I forgot to tuck in my shirt, so I'm trying to get my little shirt all set up. But anyway, so you might see this flapping a little bit. So welcome. As I had mentioned at the beginning of this video, we're going to talk about why wear a face mask. We're going to talk about the new CDC guidelines. And, you know, here on this channel, I talk all about things that are proven, that are scientifically founded, that are data-driven. This is really anchored in truth and science and information that has been clinically reviewed and assessed. So I want you to know that everything that comes from our channel is valid. And I spend a lot of time validating this. Many times I'm reading the latest clinical research and information coming out from the CDCs across the world and trying to impart that information to you in a digestible format. So I want to put that forward. Also today, I want to talk about financial health because several things are going on. We have huge unemployment rates. There's a lot of financial stress. I'm getting a lot of messages of folks being concerned about their finances, fear of what's going to happen to my retirement. Am I going to be able to recover? How long is this all going to last? So I want to go a little bit further into a free financial resource that one of my video producers, it's actually not my video producer. He's a gentleman who runs his own production company. He's actually an Academy award-winning producer in the documentary space. And they have a new documentary coming out on the 7th of April. So next week. And they're ramping up everybody in getting access to this free financial resource, which is really exciting. I am all about free stuff. And given that we have a lot of time, there are some amazing free resources online that we can tap into to help support our health. And this particularly is our financial health. And there's a big correlation between feeling financially secure and the state of your health. So I'm going to dig a little bit further into that. So welcome. We've got Pat and Anita, Angela in Ohio, Melissa Gentry in Arkansas, and Donna in Michigan, Jennifer. Welcome, everybody. I see Uper Mama and Ardora, and hello, Lymphedema, and Felicia Butts. Actually, this is a dress. So it's hard to see, but it's a total dress. It's super cute, fun. Most of the time you only see like neck up, and sometimes I'm wearing yoga pants, sometimes jammy bottoms. So today I donned a dress, and I've gotten dressed up for all of you. And then our plan as a family, we're going to go outside if the weather's nice and kick off our spring gardening. So we've been working a little bit. We're going to do gardening today. So, all right. So I want to highlight some news first and foremost. I mean, our numbers are quite overwhelming. We have jumped up by over 34,000 cases in a day. So we are on that really intense incline. You know, this is the exponential growth. We're just under 278,000. And in fact, we probably are there already, but like an hour or so ago, it was 277,985. New York surpassed 100,000 yesterday, which is pretty substantial. New Jersey's almost at 30,000. And Michigan's really moved into that incline. They're at 12,000. California's just moved up a little bit. They're at 10.7 thousand. Massachusetts is at 10,000 as well. And Florida has moved into 10,000. So a lot of the maps that you see, those are now moving into other colors. So the 10,000 is the threshold to a new color. And Georgia, I had announced on Thursday, Georgia and Florida made some pretty substantial kind of pushes in terms of public safety and ordering stay-at-home orders or sheltering in place. Well, apparently Georgia yesterday, the governor made an additional order that opened up the beaches here because of the economic impact for the beaches and the beach community, which I can appreciate. I grew up in a beach community in Florida, and tourism is a huge component. But that doesn't really welcome social distancing. And just because you're at the beach, while I love it, there's a lot of ionization and benefits and power to walking along the beach line for detoxing our lymphatics. It's not the healthiest. And so if folks are going to be doing these activities, one of the powerful impacts or the powerful impact from the CDC readjusting their guidelines is they're requiring people to be wearing masks. And these are cotton masks. They're, you know, like this is just my mask right now because it's a hardware store mask. I have a ton that I've ordered for myself and a bunch of family members. We're going to be shipping out. Those are all coming to us in the mail. But, you know, this is what I really want to detail. The news that's coming out, you know, where states are not completely sticking to the modeling and are understanding the modeling and the impact of social distancing. It has decreased the spread in California significantly. We're seeing the kind of peak in Washington. You know, they're below 10,000, and they would have been an epicenter had it not they had gone so severe. So there are aspects here that we need to take heed, and it's all, again, data. It's epidemiological data and information that we can see trends. And so, you know, ultimately, friends, we have to take our health into our own hands. And I always say this is nothing new here at Natural Health Resources. I tell my patients this, you know, I give all my patients and folks that I work with the permission. If you have an oncologist or you have an internist or you have a PT or even a massage therapist or whomever working with you and your health, and you're not satisfied, you can fire them. Well, part of that communication I have is that there's empowerment that we all have to have. We each individually are in charge of our health and wellness programs, and it's an onus. And a lot of times we give that up. We give that up to either caregivers, we give it up to the medical providers, and in some cases, like the current state, we give it up to local, state, and federal governments to do the right thing. And that doesn't always occur. And so I want to set an expectation and just really kind of give you permission to take your health into your own hands. Take your safety, take your protective personal equipment into your own hands, because this is the only way for you to feel, 1, empowered, 2, to have control, and 3, to protect yourself. I'm going to give you data. I'm going to give you information that you can interpret however you want to interpret. And we have a lot of folks that totally disagree with me. That's fine. It's totally okay. But there might be a day where they regret the fact that they didn't wear masks, or they didn't stay home, or they didn't make healthy choices. But for me, I feel like the only thing that I can do, sorry, let me mute my computer. The only thing that I can do is to give you information. And what you want to do with that is totally up to you. But I want to really let everybody know that's my mission here. It always is my mission, and it's just to empower you and equip you with information. Knowledge is power. What you do with that knowledge is your personal power. So take on that personal power, do what you want with it. You know, we're also at a point, there's a turning point where we're going to be seeing people wearing masks, and it will become more mainstream. So that's my little tidbit. I'm going to take a quick little swig. I've got coconut water for this morning. I woke up feeling dehydrated. I don't know why, but we were out a lot yesterday. I got a lot of allergy stuff going on, so I got to drink, get the fluid moving. By the way, if you guys don't, it's a little side note, if you guys don't drink coconut water, usually I don't like the plastic. It was the only thing I could get online. But Zyco is a really good coconut water brand, because it's just coconut water. A lot of times they add colors and they add sugar and all sorts of other fillers and even preservatives. But coconut's a very powerful electrolyte enhancer. And it functions, it's our alternative to Pedialyte. For Gabriel, I'll even do a coconut water, mix it with juice, and then freeze them as pops, like the electrolyte pops. He loves those. Okay, so I want to go over some additional news, and then we'll dig right on into face coverings, face masks, where to buy them. And then I really want to dig into the data of why the CDC made the decision, because it just wasn't that one case or study I presented to you all. It was a multitude of things. So I'll pull that all together. So New York is again on that incline. They are predicting they're going to run out of ventilators in 4 days, which is insane. Despite supposedly there's a national stockpile of these things and they're not getting access to that. Unemployment doubled this last week. So it was 3.3 million. I think it was 6.6 million this last week. So we have almost a total of 10 million people unemployed. I want to make two notes on this. You know, as a small business owner, I've been in business for over 15 years now. And so I have different financial banking relationships, and I've received several different emails from the different banks that I work with. Some handle our merchant service provider, some do our online sales and stuff. So there's a multitude in our, business banking, checking and savings, and all of the investments and stuff. Some banks have access to the SBA. Some have access to the SBA lending and the grants that are happening for small business owners, and other banks don't. So despite what's being told, it's not as easy. It's a more thorough, more in-depth process for a business if they were to look for financial assistance in this time, that they actually, whoever they bank with actually has to be approved to offer SBA loans. And so some credit unions, some, FDIC insured banks don't all qualify. And that I've heard a lot of businesses, because I'm in that zone, frustrated because it's being made to seem like it's really easy, and it's not. So just FYI on that, if you own a small business, or, your local restaurant, boutique owner, spa, health provider, whomever, it's affecting everybody. And there's a lot of furloughing happening with employees as companies are trying to shave off extra excess on, the bottom line, because the revenues have decreased. I do want to state this. I found this out yesterday. So one of the things for all of us in the relief, the CARES relief plan or act, the CARES Act that came out, so let's say you have not filed your taxes, and maybe you have, but you owed money, and so they may or may not have had an account with you in the last year or two. to get access to, I think it's the $1,200 per person, and then you get up to 2 or 3 children for $500. So some families could have $3,000, $4,000 come their way. Supposedly that's supposed to be in 2 to 3 weeks. They're saying realistically, we're looking at probably end of May, June as a realistic date for that. So again, setting some expectations. But the big thing here is if you don't have a bank associated with the IRS, with your tax, previous taxes, the way to set that up to minimize a really extensive delay in getting a check is to go to the IRS website. So just do irs.gov, and there's going to be information, and it'll take you to where you need to go to actually put in. So you can log in, here's my name, and or family name or whatnot. And here you can plug in your banking information. Why you want to do that is that the electronic will happen faster. Like they'll just push a button and it'll start flushing out, I say fluid because that's what I do with lymphatics, but it'll literally flush out money to folks who need it. And everybody could use that right now. If you don't have a bank associated with the IRS, they say it could take 5 months for you to get a check. Okay, I don't know anybody who wouldn't be happy to expedite that process. So I want to put that out there because today we are going to talk about some of the financials. And I think that's really, really important. Okay, so that's our news. And let's dig into face masks. Okay, so first of all, I just want to take a little poll. How many of you were surprised or shocked about the face masks, having this be something that was not mandated, but changed in the CDC guidelines? A lot of you viewers, this probably wasn't a shock if you've been watching and hearing my latest live shows. But I've had yesterday's video, I had a ton of people who went nuts on comments and got upset and were like, you're a cog. And this is, you're just buying into the CDC's evil. And I mean, it was really kind of crazy. I don't believe that. I think the challenge that we have right now is we just are in an infancy when it relates to our information on our data. And we also are learning that China was not entirely forthcoming for an assortment of reasons, but the medical professionals to keep their jobs, maybe even their lives, were underreporting. And that could very well be, we also don't have all the scientific information to articulate the best plan or approach to this from a medical perspective. So I just want to put that out there. And Sharon says, yep, it keeps changing. It's very confusing. And that's really, I want to address that because I don't want you to feel angry. I don't want you to feel like you've been abandoned by the bodies that are supposed to protect us. I also think there's a whole bunch of stuff underlying that. There's just a lot of politics, and I don't get into that. I don't want to have you guys comment on politics or anything like that. We are going to keep that void here. Really, that's not what we're about. And I keep my own personal beliefs outside of our time together. But it's just something to be aware of, that there is a stigma of when you have a whole community walking around with masks. What does that say? So there's this kind of marketing presentation. If America is walking around with masks, we have a major problem. We do, but it has an appearance. So that's one thing. It also has a personal appearance. A lot of people are a little nervous because what does that say? Does it mean you have this virus? And so I know a lot of people are pushing back on that. I hear all of those concerns in the comments, and I want to address, I want to validate each of them because it is confusing, because we don't know everything. We still don't know everything. Will we know everything in 3 to 5 years? Probably not. We'll still be running research and data and culturing things. So we just kind of have to be a little bit flexible. But again, at the end of the day, I've had a lot of people go, well, this is common sense. Duh. Yes, it is common sense, but not everybody is equipped with the information or the background, so not all of us have studied science or medicine. And so a lot of folks just rely on what they're being told. So I just want to put that out there. So don't be hard on yourselves. Let's just move forward with the new recommendations. And ultimately, it's meant to protect you from other people. It's meant to protect other people from you. Okay, so there's really multiple sides of this. And I actually kind of wrote down several of these points. So one, it keeps you from shedding the virus. And I want to dig into that further. So there is something that we now have assessed, and we have research from Singapore. We have the China's CDC, and we also have our CDC, some studies there. And we also have a study that I mentioned earlier this week from the University of Nebraska about viral shedding and an assessment of the transmission. And one of the things that we need to be aware of, like Singapore, they assessed 243 cases. Of those cases, 6.4% were transmitting the virus and they had no symptoms. So that is something we need to know. People who think they have, here in the US, you kind of think, okay, I have symptoms, I'm going to stay at home. So maybe these essential workers aren't feeling symptoms, but they're asymptomatic. They're not wearing a mask, so they're not protecting any of us, and they're out delivering our groceries. They're out shopping with us. They're out providing us customer service. They're at the gas station. They're at the doctor's offices, and they think they're okay, but they are actually shedding a transmittable virus. Okay, so that's something we need to be aware of. That's one point. That's one study, and I'll link all those down below too. So that's one study. The second study came out of China. And this is, okay, so this is related to specifically assessing how soon do people start shedding the virus and how soon are they contagious before they test positive. Okay, so this is a little kind of a tricky study. So you can be not sick, but still asymptomatic. So this is where we started to assess the symptomatic nature. Actually, I need to change. Hold on, you guys. I am having problems with one of my chairs. I need to change my chair. Hold on one second. Hold on, everybody. I'm going to do my balance ball. Hold on. Okay, so, oh gosh, this one chair, I've noticed when I sit on this one roller chair that it bothers, I only have this one little varicose vein, and it, for some reason, after I had Gabriel, it really bothers me. So I think I'm just going to have to do the balance ball. Okay, so you might see me bouncing a little bit, but I got to be healthy to help you guys. Okay, so back to the study. So the study was taken really early on. So China looked at this in January and February, and they basically said that you can be transmitting the virus. You can be contagious 2 days before you actually show symptoms, and even before you test positive on a test. There was 44% of their patients were transmitting this early. So to 44% of these patients that were profiled in the study, they were not showing symptoms. So that's where we came out in March and said patients can be asymptomatic. And that's where the stay-at-home orders really kind of came from based on that. So that is really telling. And that's one of the reasons why masks are key. So there's several kind of aspects. There's viral shedding. And basically what we know right now is that at minimum 2 days before you show symptoms, if you are going to show symptoms, you might be transmitting the virus and not showing any symptoms. No fever, no, chills, no sort of gastro, coughing, any of that, no shortness of the breath, that you're walking around totally fine. You're at work doing your thing, and you are, if you're not protecting, or if you're not wearing a mask, this is where the mask comes into play. If you are not wearing a mask, every time you cough, even breathe, you laugh, ha ha ha, you're, getting water with friends at a break, you're at lunch and you sneeze, you're transmitting. We know through MIT's data that a sneeze and a cough can travel 23 to 27 feet. And if you've got viral load, the virus is shedding, you've got viral droplets now that are contagious. Everybody within 23 to 27 feet is going to feel the impact. Well, now if you put a mask on, that limits it greatly. And especially oh my gosh, you guys, I got such flack for this. People told me it didn't look like it fit, and actually it does. So when I put this on, it's really sealed. Like, it actually leaves a mark on my face. So I had people freak out that thing's too big for you, because I'm talking and trying to talk with a mask. So it looks weird and it probably looks like it's bigger. And then they were like, you didn't seal around the nose. And I actually did. And I have links in the YouTube box for masks that have the metal adjustment so you can seal it. So for any of you on YouTube, DM me and I'll grab you, or anybody on Instagram, DM me and I'll link to you masks. On YouTube, just hit the little arrow in the description box. And those are vendors. I had to do a lot of research before I put that video. So many of the vendors I've pushed people to via Etsy have sold out. So my one patient friend, Sarah, is pumping. I've been in touch with her. She's got metal inserts, a really pretty material. She has masculine and feminine, 3 different sizes. And she's like, I'm ready to go. She's like, I've got a whole production line process, and she's delivering these. She's advertising 3 to 5 days, but she's like, I'm basically getting them out every day. So one of the things that I think is really important is to know that when you wear a mask and you're asymptomatic, you actually limit. So a mask cuts down on the outbound transfer of the virus. Okay, so it doesn't mean that this doesn't necessarily, not all of these, this particular one, that doesn't mean it totally protects you from the virus, but it protects you from spewing this out. So the social, and when I first started putting out these videos, I talked about in February, we were in the social communal, it's called communal spread. So that, now it's not direct transfer. It's literally, it's everywhere. These particles are in our air. They're on, materials that we're touching. They're everywhere. And research shows the viral burden is pretty intense. And because of that spray, 23 to 27 feet, it can be on ceilings, it could be on blinds, it could be on desks, it can be on chairs, everything. So this is one thing. It does minimize that burden. But also, when you wear a mask, if you aren't protecting your hands, which by the way, you should, and I have ideas on how to do that. If you are not wearing protective covering on your hands and you touch something, and ordinarily, a lot of times you just don't even know that maybe you you have a little itch on your nose, or, I'm going to put lip balm on, but I'm going to smear it in, or you look at your mouth or whatever. You touch your hands to your mouth, you touch your hand to your nose. This protects you from you. So there is that aspect. Okay, so the mask does have that protection, particularly from hands. Now, the CDC didn't go at all into goggles or eyewear, and I include that as part of the I don't want to say protocol. I got a letter, not a letter, but I saw some information out from the FDA, and they're really clamping down on vendors and a lot of the brands that we work with for supplements and stuff. And so they're really clamping down on anybody making any type of claims. So I just want to put it out there that, what you want to do is you want to protect every aspect. You want to protect others. That's important. You want to protect yourself. Transfer, we know, particularly is going to come from hands to mouth, hands to nose. I saw somebody posted that, ear transfer. Honestly, I haven't seen any data, any studies on that. I'm not saying that isn't the case, but honestly, the most important orifices for us to protect our nose, our mouth, and our eyes, and they're forward bound. So if we're around somebody and they cough, we might get that side hit. That's why you want to have eyewear that extends on the side so you don't have that creeping in. That's why I do like to have the metal kind of adjustable nose piece, so then you can really kind of cinch this in. So that is where we're kind of at. It minimizes the shed, the shed spread. So it minimizes the viral shedding and being able to spread. And it is about protecting others and limiting the overall exposure risk. So if everybody is protecting themselves with this, we have less of that transfer moving into the human body. And there's really 3 phases to the virus. And this is very, very similar to the flu. Okay. We have there's several. There's first presymptomatic. So you've been infected, you have had the contagion, it's moved into your body, your immune system starts to register. It's like doing its like, blah, 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 and like, boop, red alert. There's some foreign entity in our body. That is presymptomatic. The immune response hasn't occurred. There's a time frame. Sometimes it's 2, 3, sometimes 5, 7, 9 days. Kind of depends on your immune response. But there is a period of time where you're infected and you are contagious, and your immune system is starting to recognize and do its army duty. It's starting to ramp up for a war. That time frame, if you are not protecting yourself with the mask or protecting others, you're part of the contagion and you are spreading it. Now, then you move from pre-symptomatic to symptomatic. Those are folks that have the 101 fever. Those are folks that are in the hospital. Those are folks on ventilators. Those are folks quarantining at home. They're folks going out and calling and getting the tests. They're getting the positive results. They're quarantining. And they're dealing with these intense viral symptoms. Now, there's a category of folks that are pre-symptomatic that continue to never have any symptom. That category of folks, if we go back to what China's original study looked at, 44% of these folks that were transmitting the virus had no symptoms for 2 days. 40%, 44%. We look at the Singapore study, and 6.4% of that transmission was pre-symptomatic. That's problematic. So we have a lot of folks that are walking around who are not ill. And we don't even know what that percentage is here in the US. Who knows? It could be 5%, it could be 20%, it could be 80%. Who knows? Everybody's individual immune response will be different. Our DNA, our biochemistry, the makeup of our body varies. And that's why we have these variables. Some people might have had what they thought was the flu and they actually have the virus or had it. Now, I also want to highlight some other information. There is, so in March, middle of March, the University of Texas, their epidemiological department, so a whole bunch of epidemiologists, I always say that wrong, they assessed China's information. So they worked with all the data that we had been provided from China. Okay, so just know that it was as good as the information coming in. They found that 10% of the cases that they assessed, 10% of the cases in China were pre-symptomatic in their spread. Now, out of some of those, they went to symptomatic. Others did not. So we know we have to catch it before you even feel it. And that is why we're going with a whole bunch of face mask recommendations. That's why face coverings that are non-medical grade, I want to clarify what that is. I have a lot of you asking, I need to get an N95 mask. You don't. The medical providers at this point, they need it. The frontliners, we need to keep them healthy so they can take care of us. They're the ones that need the N95 masks, but we need to be wearing and protecting each other through our mask wearing. There are other things and caveats I want to highlight. This is just one layer. Is this the best protection? Heck no, it's not. So I don't know if YouTube you can see it. It's not the best. And I'm aware of that. I've ordered other and better, and I'm just waiting on my wonderful mail delivery carrier to bring them. And I have one so I've decided that we are buying all of our delivery crews. So we have a UPS, our Amazon guy, like they're the same people every time. We're buying them masks, and we're going to get our mail carrier masks because they're the ones that we're encountering the most. And I want to protect them, but I also want to protect us. So one of the things that you need to know is that there are a whole assortment of mask options. you can DIY your own mask. And in YouTube, currently, I've posted 4 or 5 videos to professionals. One is a seamstress, and she shows you how to cut your pattern and all the materials you need to make a mask. So I also put up the Deaconess Health. They have a mask process, a PDF that I talked about 2 weeks ago now. Also, I've highlighted a gentleman who does a whole bunch of, like, I don't want to say he's a doomsday prepper, but he's like an emergency guide. Like, even if you have a dire emergency, his channel is all about that. And he posts a pretty good mask video, and he just put it out about 2 hours before mine went out. I don't think he has kids. I'm like, gosh, these people put this stuff out so fast. Like, we were trying to manage dinner time, and I literally I produced the video, shot it, edited it, got all that, put it together, all the links, found all the Etsy stores that are still selling and making stuff for all of you in the window from starting dinner to bedtime for Gabriel. So it was like an 1.5-hour window. I whipped it up for you so you could be armed and really equipped with good resources. So for Instagram, asking the links, DM me, I'll send you those. Or if not, switch over to YouTube, and the links are in the description box below. Instagram, until I reach 10,000 followers, I can't have you link. It doesn't let me send you a link or go, these are the masks I love, and you can swipe up and get them. It just doesn't have that capacity. So you can help me by screenshotting this, sharing this, tagging me with all your friends so we can get more followers, because I think we're 6,000 away from that. But at this point, YouTube has all of those. But I want to highlight something else. There's the back end of this virus. So we know you can be presymptomatic and asymptomatic and spreading it. So spreading the contagion. We also know from a newer study, and this comes from specifically the Chinese CDC, there is a hospital, it's called Ditan Hospital in Beijing, and they assessed between January 20th and February 27th. So just over a month of a time frame, they assessed 133 patients. And they looked at the testing. So to get released from a hospital, you have to have 2 negative tests. And we do a nasal swab. We gonna do a little insert in the nose. Well, they said the majority of the virus is here in the mucus that's in our bronchs and in our lungs. And they were recommending that we did more of a spectrum, where it's the mucus that comes up from a cough or like more of a throat swab versus the nasal swab. So that was one thing they wanted to identify. They said, are we sending out people that are testing negative, but they are, like, the big question is, if we're going to limit the transmission, as we release people, are they okay to be released? Are they free of the virus? Are they potentially spreading it? They're fine, but now they're contagious still. So that was the question. Are these people contagion free, or are they contagious? And they personally test negative, but the virus is still alive. So what they did is they tested 2 things. They tested the mucus from, like, the bronchial cough congestion. That was tested. And they tested their fecal matter, so a bowel movement. And what they identified is that the spectrum, the cough, the mucus, this was after these people tested negative, like, they were deemed virus-free. The cough continues even after they are negative. The mucus, the spectrum that came up that they assessed, actually contained the virus, live virus, and viral DNA for up to 39 days. So let's say you have your hospital stay. Some people are in, they have oxygen, so they're in and out 6 days. Others are ventilated. That's a 3-week, 4-week process. I mean, just because you come to and you're back in, some healthy state in the ICU, you're alive, you have to get downgraded and you kind of move through the process of being exited out of the healthcare facility. So that's a period of time. They found the spectrum showcased the viral DNA and was active up to 39 days. That's insane. They also assessed that the fecal matter was alive, or not, it wasn't alive. I shouldn't say that. The fecal matter, when they tested it, they showed viral DNA. So viral shedding on both of these. People shed the cough still sheds the virus up to 39 days. Fecal matter sheds the virus up to 13 days. And what they found is in the patient's room, they would test the toilet bowl after they used the toilet, and they would test obviously the fecal matter. They'd have a fecal culture. But they found that the virus, if people didn't disinfect their toilet, the virus stayed alive in the toilet bowl. So that just, be a little bit more conscious about your toilet bowl cleaning. They did find that after it was disinfected, the virus died. So it did showcase that good disinfectant practices actually killed the virus. But that's really important to know, because what they were trying to do is, this is like a month into mass chaos, okay? Potentially, maybe even a little bit longer, as we're hearing. Maybe they had these cases in October and aware of it, who knows? But essentially, they were trying to identify, like, how is this thing spreading and how can we limit it? So they start testing everything that they kind of think, like, okay, let's test your cough, because we know you've got mucus, and you're going to have mucus even after the fact, especially if you have pneumonia. Anybody who's had pneumonia, you're going to be coughing out that gunk that has built up. It's fluid, it's mucus, it's junkiness, and your lungs are going to detox. And so how much of that mucus is the virus living in, and is it transmittable? That's what they assessed. So, it's 133 patients. It's not a huge sample size, but that does tell us more about, we know, in the beginning, you could have 2 or 3 days before you become symptomatic, that you're shedding and you're contagious. And now we know potentially that your phlegm essentially has the contagion in it. The question still remains, it shows the virus, but is it just the DNA? Like, is it the immune system breaking that down, or is it live and fully active for the whole entire time? So Paula, DM me. I'll send you the link. Okay. Sharon, let's see. Okay. So, let's see. Okay. So that is really, really kind of eye-opening. And earlier in the week, I highlighted this. This was the CDC's Morbidity and Mortality Weekly Report. In here, they actually talk about the pre-transmission, and they highlight 1 to 3 days is your kind of pre-transmission rate. So, it's been cited by also our CDC as well. And I didn't put a link to that. I'll make sure I grab that. But that is what we're dealing with. And that is what we know right now. Now, as I always say, this is moving, this is changing. And the thing is I don't want you to feel a lack of trust. There are some folks that aren't probably highlighting what you need to know, because maybe they're trying to err on the side of being positive. But let's, in my communication in every hourly show, I will always give you data, science, and things that have been founded through clinical research, and put that out there. You can do what you want with it. But I think it's important to know that people are shedding the virus. They're technically contagious, and they are infecting people. And the infection rates, you can infect, people who are asymptomatic or pre-symptomatic could infect people that are fine, and they can infect people that are not fine, that have underlying health conditions like I talked about earlier in the week, highlighted. These are the different cases that fall into a category of needing ventilation. Diabetes is a big one, lung disease, renal failure. Those are all really key health conditions. Same with underlying heart disease. So some people don't even know they have those underlying health conditions. And that is really, really important. Information is power, and I want you to be empowered to make healthy choices. So that's why we're talking about this today. And then also, really understanding the asymptomatic viral transmission. That is something that we are going to hear more about. We're probably going to see more studies and more research. I know that right now our frontliners are, they're in it. And so there are going to be people that are the epidemiologists. They're going to be doing the data. And I know they are. All these schools, these people are in it. They're trying to sort through the data. This doesn't turn over as quickly as we want because they have to look at so many different variables. And to that note, I want to highlight Thursday, I put out a challenge for all of you to support your local hospitals. I'm pleased to announce, I don't have the pictures of it, but yesterday, we were actually able to coordinate with our local hospital. North Fulton Hospital is our closest hospital here for us. And it's part of the WellStar community. And I had called and actually got a call back from the hospital's executive administrator who said, okay, we're doing all these, there's certain coordination, certain delivery point. And she's like, okay, telemed and med surge, we're going to cover their food. And so she basically told us who was going to get it. I said, I want to do the PM shift. So at 8:30 last night, we sent in 30 meals, box meals to that group. So I'll be posting those pictures. She said they post them and then they tag the parties. A few things, if you do that, I've learned a lot. So number one, I wanted to support a local restaurant. And we worked with a vendor that I've never eaten at their place, but their menu looked really great. And then they did little box lunch, pickle, a side, and then they had these little homemade cookies. So I thought that's great. It's contained. People can grab these boxes and enjoy them. So I gave her all the information over the phone, did follow up as we got who to contact, where to go. And I have to find out this morning, the delivery driver totally screwed it up. She got there way before schedule. She called the wrong number. She called me. And then she gave me an attitude when she called me last night. I was so frustrated. I have to call the restaurant because I don't think she's a great representation for their brand. But so my takeaways, if you guys do this, number one, these hospitals are overworked and they need nourishment. They actually need good nourishment. So think about it. We bought 30. You might not have to buy 30, but even we have green juice vendors and restaurants that have breakfast menus and catering menus. Think about that. It wasn't as expensive as you might think it would be, and they were so beyond elated when I was like, we want to come in. Do you guys accept deliveries, and how do we do this? Are there any requirements? Call your hospital. And find out, because there's usually some sort of method or process. So you need to do that before you just kind of go, okay, I want to deliver to the ER. So coordinate that, call the hospital, and they'll direct you to somebody on staff that's organizing that locally. And it was great because I asked her, where do you need more coverage in terms of who needs to get some support? And she's like, the PM shift. So the shifts shift at 7 p.m. So we organized 8:30 so that, they got organized, kind of settled, and basically they could have, from like 8:30 to 10 or 11 food, mid shift for them. So just know that is there. Facebook's a great resource. Check out your local hospital because there are companies that are catering to them. And they also can give you recommendations of local restaurants because some restaurants have closed. Some of my favorite ones that I wanted to support were closed down. And so it's a great way to support your hospital workers and also support local business also. So, that was a little fiasco last night. That was all happening while I was putting out the video. And then on the other note, so financially, I know a lot of you are stressed about finances and, depending on the day, you look at the stock market and stuff's like up and down. So you guys know I had been interviewed by Revealed Films back in June. They flew me out to Utah and I interviewed about my work in the herbal botanical, I don't name, 3 letters, starts with a C, ends with a D. I had been interviewed with them and they put me in the interview in their series and it was called Pain Revealed. And basically every quarter, Jeff and Dr. Patrick do these Revealed series and they're very in-depth. They identify experts with extreme intense knowledge that are unique in terms of like delivering you information that might not necessarily be totally mainstream. And they put out a wine reveal. There was one that was called Money Revealed. I don't think I really posted a lot about that. But then they did Supplements Revealed. I know many of you watched it and you loved the Supplements Revealed. Well, they're back at it with a new one and it's called 20 It's called Crisis Investing 2020. And they've pulled a lot of those folks that they interviewed for Money Revealed and a whole bunch of other ones. And they did Skype and Zoom chats, and they're actually in the mode of putting all that together. And I don't even know, like usually they list out because it's so organized. Like they do this 6-7 months ahead of schedule. This is so like on the fly that they don't have who all is going to be in each of the episodes, but usually it's 8 or 9 days of 3 to 4 interviews. And these episodes go live one day, and then the next day you get episode 2, and then 3, and then you kind of get the series. They're amazing, and it's free. So you can get access to what do we do with our money now? How do we protect our retirement? What do I do if I've lost my job? Resources, things to be aware of from all different layers. If you're a small business owner, things to understand. Also navigating the CARES legislation, potentially navigating any new legislation that comes out. So I've got a link in YouTube down below where you can register. So all they need is the email that you want to receive the episodes to. So just think about the email. If it's, do you want to watch the episodes on your phone? That's usually how I watch them. I used to watch them as I was driving. No, I'm not. So I'm going to use a different email address to watch on a different platform. But just know you can register for free, name and email. That's all they need. And they put it out there. So it's pretty amazing. And I really encourage all of you, if you have any financial stress, strain, you're feeling it, even if you haven't lost your job. I mean, these are unprecedented times. And we, just like you guys rely on me as an expert, these are money finance experts that we can also lean on and take information. And again, take what you want with it, but at least we can be knowledgeable. So that's really, really key. All right. So let's see. I've got a lot of comments. Again, I want to kind of encourage folks to let's keep the politics out of our comments. Let's try and be as positive as we can. At the end of the day, every day is a new day. And I saw actually on the news, they're like, every day is like Groundhog Day, especially in this kind of mode that we're in. Like we're all at home, same family members every day. It's really fun. But we're going to learn more. We're going to learn more about the virus. We're going to learn more about ourselves, our resilience. We are going to connect better with our friends and family. I love so many of you who have sent us letters. We're getting more and more every day. Gabriel and I have started, for all of you who aren't aware, Gabriel and I started a pen pal program. So Gabriel, my son, is 4.5, and part of the homeschool program with the school and with us, I want to start to have him learn more about the states and areas where people live. And so what better way to do that than to have all of you send us letters? And now we're all working from home. So I give out my home address. I mean, you can find it if you wanted to, so it's no surprise, as a business owner. But the one thing that we're doing is he opens the letter. I read it to him, and he's really cute because he interprets it's like, oh, hi, Gabriel. You're such a handsome boy. Hope you're doing well. So we read that, and then he turns around and we create a card for you, and he writes your name. And so we're working on his writing. So if you want to encourage that for my son, I welcome you to do that. And I will, in this particular video, I'll add our address in to the description box. For Instagram, just DM me if you want to participate. And we are sending out letters every day, and it's really fun. It's something that he and I are doing together. So it's our kind of fun little tradition that we've got going on. And, I love that. So I just want to put that out there. Tomorrow's topic, I actually want to, well, first of all, let me throw out a bit of news. So for all of our YouTube community members, so this is a private community page or community program where you opt in. I think you pay $4.99 a month to be one of our members. This afternoon, 3:30, we're going live. So we're going to have a live Q&A session with myself and all of our members. So if you all want to participate on YouTube, all you have to do when you go to my main YouTube page, my main YouTube profile, if you hit the join button, that actually will connect you to join the membership. And so I have had a lot of you ask questions about specific questions about health and wellness for yourself and wanting me to cover, hormones or thyroid or whatnot on these lives. And I really house only information related to the current news about the virus and all the other kind of details, the topic at hand, because I wanted to be really focused. But this is a way for us to have a live Q&A that addresses your health concerns, talks a lot about other kind of health related matters. And tomorrow our Sunday coffee chat, I'll be in my robe. I am going to cover tomorrow about the hormonal impact of this current state. So, I've got to label it, but it might be like pandemic hormones or, the impact of, stress and quarantine on your hormone health, because that is something a lot of you are dealing with and facing, and I want to address that. So that is something that I wanted to address tomorrow as it relates to this kind of space. So if you do have any specific questions about your hormones, let me know, DM me or comment in the video comment box. And for any of you watching on the replay, just comment down below and let me know what your hormone specific questions are, and I'll address that with the slant about how staying at home, change your routine, stress, different eating routine, all of that plays. There's an influence that this has on our hormones. And so that is something that I want to address and also validate, because a lot of you are experiencing those symptoms already. I am too. I mean, I'm like, this is definitely a byproduct of the stress. And so, do know that you're not alone. And this is very, very common. So, and I'm seeing a lot of folks on here. Okay. Ace Cat said, our kitchen to yours is an amazing healthy catering service. Oh, that's cool. Yeah, that's great. So I see a lot of people being inspired, deliver stuff to your hospital staff. I tell you what, I think what I'm going to do, because I tend to be one of these people, like I like to organize big events. I'm going to reach out to our neighbors and see if we want to do like a neighborhood. We might do like a money collection online, and then sponsor like from our neighborhood. We live in a particular neighborhood and we have a name. And so we'll just say from, Fox Haulers, and I think everybody would be into it. And, the other thing, Brian's like, are we bribing our medical workers? Like, does that mean that they'll give us ventilators if we need them? I mean, it's nothing to joke about by any means. We weren't joking, but it was one of these things. He's like, we need to make sure that we're taking care of them. And it's really true. They're working their butts off. They're frontliners. They don't have all the right personal protective equipment. And I just want to make sure they're okay and taken care of. So if you can do that, that is so fantastic. And you totally will feed the soul as well. So friends, thanks for tuning in. I would encourage you, for all of you on YouTube, please give me a thumbs up. Same here on Instagram. This replay is live on the replay, on the live for about 24 hours. You can always catch it here on YouTube on the replay. I encourage all of you to comment down below and even do screen grabs, share it on your stories for all of you on Instagram, and just tag me at Natural Health Resources. People can then follow and watch. And Kim had asked, what about kids wearing masks when outside riding their bikes? Yes, masks, hats, and glasses, goggles if you can. So, and even like almost summertime, we're starting to pull out summer stuff. Have them wear their swim goggles. That's highly protective, especially when they're riding their bikes. So kids, I've got links to even infants, babies. There's one company that they're doing baby, 3-month-old, 6-month-old, 9-month-old. So, I really wanted to try and cover everybody. And then options, multiple layers, filter insert. There's filters that you can put in it. As soon as all these masks come, I will kind of give you like a little mask tutorial. I'm just waiting on these items arriving. And I've had a few say, that's going to take us a few weeks, which is why I've recalibrated, posted links to brand vendors, Etsy shop owners that are actively making and shipping these things out, because time is of the essence, friends. So thank you for tuning in. Instagram, you guys are coming off on here on 20 seconds. I'm so grateful for all of you who joined. and participated this beautiful Saturday morning. And for all of you YouTube members, I will see you at 3:30 for our private YouTube community member live Q&A session. And that will be about an hour as well. And I'm super excited. So thanks, everybody. I will see you later. All right, so let me save Instagram. Okay, so thank you, all of you on YouTube. I'm so grateful for your participation. As always, it's a pleasure and honor for me to join you this morning. And thank you. So please like this, hit the share button, and tune in tomorrow. We're going to talk about hormones and the influence of this crazy time on men and women's hormones, including teenagers. So if you have any teenage daughters, particularly, grab them, put them in front of our live show. I'll be answering a lot of questions. So we'll dig in. That will be highly interactive and engaging. So don't hesitate to ask me any questions. All right, friends, I'll see you tomorrow. Be safe and well.